Optic neuritis is a condition characterized by inflammation of the optic nerve, the crucial nerve that transmits visual information from the eye to the brain. This condition can cause sudden or gradual vision loss, usually in one eye, along with pain and other visual disturbances. Optic neuritis is not a disease itself but rather a manifestation of underlying conditions, often autoimmune or infectious in nature. Understanding its causes, symptoms, diagnosis, and treatment is essential for managing its impact and preventing long-term complications. Causes and risk factors. The most common cause of optic neuritis is demyelination, a process in which the protective myelin sheath surrounding nerve fibers is damaged. This demyelination disrupts nerve signal transmission, leading to vision problems. Multiple sclerosis, MS, an autoimmune disorder affecting the central nervous system, is strongly associated with optic neuritis. In fact, optic neuritis is often the first presenting symptom of MS in many patients. Other causes of optic neuritis include infections, such as viral or bacterial infections, which can trigger immune-mediated inflammation of the optic nerve. Certain autoimmune diseases like neuromyelitis optica spectrum disorder, NMOSD, and systemic lupus erythematosus can also lead to optic nerve inflammation. Additionally, some medications and toxins, although less common, may contribute to the development of optic neuritis. The condition typically affects young adults between 20 and 40 years of age and is more prevalent in women than men. Individuals with a family history of autoimmune diseases, particularly MS, are at higher risk. Symptoms. The hallmark symptom of optic neuritis is a sudden loss of vision in one eye, which can range from mild blurring to complete blindness. This vision loss often develops over hours or days. Patients may also experience changes in color perception, particularly a reduced ability to distinguish red hues, a condition known as dyschromatopsia. Pain is another common symptom, usually exacerbated by eye movement. Some patients describe a dull, aching sensation behind the eye or around the orbital area. In addition to visual disturbances, optic neuritis may cause flashes of light, flickering, or decreased contrast sensitivity. In severe cases, visual field defects may occur, such as loss of central vision or peripheral vision. Diagnosis. Diagnosis of optic neuritis is primarily clinical, based on patient history and physical examination. Ophthalmologists typically use tools like a slit lamp examination, fundoscopic examination, and visual acuity tests to assess the extent of nerve damage. In many cases, the optic disc, the point where the optic nerve enters the retina, appears swollen, a sign known as papillitis. Magnetic resonance imaging, MRI, of the brain and orbits is often employed to detect inflammation or demyelinating lesions along the optic nerve. MRI is also crucial for evaluating the risk of developing multiple sclerosis, as the presence of white matter lesions in the brain significantly increases this risk. Additional tests may include visual evoked potentials, VEP, to measure electrical activity in the optic nerve, and blood tests to rule out infections or autoimmune disorders. Treatment. Treatment of optic neuritis focuses on reducing inflammation, managing symptoms, and addressing the underlying cause. Corticosteroids, either oral or intravenous, are commonly used to accelerate recovery and improve vision. High-dose intravenous methylprednisolone is often administered over 3 to 5 days, followed by a tapering course of oral steroids. While corticosteroids can speed up visual recovery, they do not prevent long-term vision loss or the development of multiple sclerosis. For patients with underlying autoimmune conditions, disease-modifying therapies may be prescribed. In cases related to infections, treating the primary infection is critical to resolving optic nerve inflammation. Pain management, including nonsteroidal anti-inflammatory drugs, NSAIDs, may be recommended for patients experiencing ocular discomfort. Prognosis. Most patients with optic neuritis experience significant recovery of vision within weeks to months, although some residual visual deficits may persist. Approximately 50% of individuals who develop optic neuritis may eventually be diagnosed with multiple sclerosis, highlighting the importance of close monitoring. Recurrent episodes of optic neuritis are possible, particularly in patients with underlying autoimmune conditions like most, which can lead to more severe and lasting visual impairment. Conclusion: optic neuritis is an inflammatory condition of the optic nerve that can cause sudden vision loss, pain, and color perception changes. While often associated with multiple sclerosis, it can also result from infections, autoimmune disorders, or other systemic diseases. Early diagnosis and treatment are crucial for improving visual outcomes and managing underlying conditions. Though most patients recover vision over time, ongoing medical follow-up is essential to monitor for recurrence or progression to chronic neurological disorders. Awareness and timely intervention remain the key factors in preserving vision and quality of life for individuals affected by optic neuritis.